Good morning. I'm Isabel Lawicka. I'm the Head of Policy and Analysis at NHS Providers. We are the membership organisation for NHS hospital, mental health, community and ambulance services that treat patients and service users across the NHS. The impact of the last year on all of us is hard to put into words. We've all been affected in different ways, and all of us will need different types of support, interventions, and activities to help us recover, protect our well-being, and return to normality. And NHS staff are no different in that respect. But where NHS staff are different are the huge lengths they have gone to sustain our health services, the risks they've taken on behalf of us all, and the immense pressure they've been under for such a sustained period of time. It's easy to become immune to some of the stats we see flying around in the media all the time, but some of the figures are really astounding and worth dwelling on. Across the whole of January this year, there were an average of 30,500 COVID-19 patients in hospital every day. On the 8th of January, the daily cases recorded reached a high of nearly 62,000. On the 12th of January, there were over 4,000 hospital admissions in one day. On the 26th of January, the NHS passed the tragic milestone of 100,000 deaths from the virus. All NHS staff have been directly affected by this disease in one way or another. The context is important as well. When the pandemic hit, the NHS was coming out of an already tough winter. NHS trusts were already grappling with rapidly growing demand for healthcare. The NHS was facing its longest and deepest financial squeeze in its history, with over 100,000 workforce vacancies in the trust sector alone. And staff were exhausted after coping with year-round levels of the type of demand that used to be seen more usually in winter alone. And when the pandemic hit, the NHS was forced to create sufficient extra capacity at great speed. It adapted to new ways of working and has sustained throughout challenge after challenge. This wouldn't have been possible without the dedication and commitment of staff. Trust leaders are enormously proud of their people. They've told us repeatedly that the goodwill and commitment of the NHS workforce during the pandemic has been truly outstanding. They've commented on the way that everyone came together in the best interest of looking after patients and colleagues. And let's not forget, staff were going into unknown situations, they were putting themselves at risk. People were worried about transmitting COVID to their loved ones, and some staff were disproportionately affected. For example, the pandemic brought into sharp relief the health risks associated with long-standing racial inequalities. And this all hasn't happened without taking a toll. In a survey we ran last year, 99% of trust leaders voiced their concerns about the level of burnout across their staff. And that was before the latest COVID wave. More recently, trust leaders have talked to us about the sheer exhaustion of staff and fears about the mountain still to climb in terms of tackling the growing care backlog. I'm going to reflect on three things this morning. Firstly, what have we learnt from the last year in terms of the type of wellbeing support that staff have found useful? What have we learnt about bringing in greater flexibility and innovation into our working practices? And what needs to happen next? Firstly then, what type of wellbeing initiatives have proved helpful for staff? Trusts have adopted both innovative and tried and tested ways to support staff over the last year, often incorporating kind offers of support and donations from their communities and local businesses. This has included offering 24-hour mental health support for staff, putting together welfare packages to ensure staff have food and other everyday supplies available to them, setting up staff helplines. The ambulance service made use of welfare vehicles so they could help staff on the go. There has been enhanced occupational health, peer support and counselling. Some trusts have developed bespoke podcasts around stress, anxiety, sleep, nutrition, and run Facebook Live sessions to support staff. And effective leadership has played a key role in this across all levels of the NHS. Trust leaders have talked about the importance of being visible leaders, being honest, calm, and hopeful. The importance of acknowledging when actually things weren't going to plan. They also talked about the importance of teamwork and good communication, all those fundamentals of supporting staff and their well-being. Very importantly, there has also been dedicated support for Black, Asian, and minority ethnic staff and volunteers. We all know there's far, far more to do in this area, but the pandemic has at least opened up some challenging conversations, which were long overdue. And it's vital that this continues, crucially with targeted action in response to hearing about the lived experience of colleagues. Overall, there's been recognition that there is no one-size-fits-all to supporting staff and protecting their well-being. There needs to be a range of support on offer, and different things will help different people at different times. What's also important is that trusts and our government and our national NHS leaders all continue to have staff well-being and recovery at the top of their list of priorities. I'll move on now to reflect on what we've learned about bringing in greater flexibility and innovation into our working practices across the NHS over the course of the pandemic. Wellbeing is often spoken about in relation to individuals in terms of supporting individual resilience and coping mechanisms, but we also need to look at building a resilient system. We know that workforce wellbeing will be far better protected by realistic workloads, more regular breaks, a better work-life balance overall. We also know that patient safety is enhanced by having this focused on organisational resilience. But we know that going into the pandemic, the conditions weren't set for that to happen. So there were already thousands of vacancies and therefore little resilience built into the system. This meant trust had to be really flexible, really innovative in relation to workforce deployment, and this was made possible by flexible, dedicated, committed staff. And there is learning here that we can retain to help build a more flexible system for the future, and thus make it possible to support our staff better. This sort of approach in terms of flexibility in the scope of staff roles and deployment in the NHS has traditionally been quite limited, but this really quickly changed in the first wave particularly. Staff quickly made themselves available to provide support, take on additional roles, and were quickly trained in new skills. And staff movement between organisations and different clinical settings was made more straightforward by reduced red tape. For example, ambulance trusts quickly were able to retrain patient transport staff to work alongside paramedics to increase their 999 response capacity. And this sort of approach has not only built more resilience into the system, it's also helped patients. For example, we've heard about physiotherapists being redeployed to wards and how that's made discharge for patients much quicker and therefore improved their patient experience. Another trust reported how the skills of a paediatric nurse redeployed to a care home had proved hugely beneficial for the residents there. And we've seen trusts committing to keeping redeployed staff involved in a couple of shifts per month to ensure they retain those new skills they've acquired, building greater flexibility into the system for the future. There have, of course, also been a range of positive developments related to the increased use of technology during the pandemic. Trusts have told us that this has led to benefits in terms of outpatient experience and enabled better prioritisation of care delivery. It's important to note that in future, use of virtual consultations and care must be designed around patient feedback and what patients want, but technology certainly allowed more flexibility in the system and there are elements that patients and clinicians will want to retain. In a survey we ran last year, all trusts reported that they will continue to deliver some care remotely after the pandemic, and 86% of trusts had increased their capacity for remote services at that time. Lastly then, what needs to happen next? As, thankfully, COVID cases have reduced dramatically, attention is now turning rightly to recovery of staff, recovery of services, as the capacity needed for COVID patients recedes. And the recovery challenge is, I think, as important as the COVID challenge. It will be more sustained and will require the same innovative thinking and the same stamina to get us through to the other side. And a focus on staff wellbeing and recovery must be at the centre of this. It's important to acknowledge that recovery will mean different things to different people. Some will find recovery in a returning normality in everyday life. Others will need normality to return at work to start to recover. Everyone's experience has been and will be different. Trust leaders are telling us that the NHS can't afford to be reactive on staff recovery as we move back to the delivery of a wider range of services and tackle the huge care backlog. We must think of staff wellbeing proactively rather than diving headlong into dealing with the backlog and then reacting to the inevitable impact on staff later on. Local wellbeing initiatives will need central funding to continue so that trusts are not forced to pull money away from them to invest in frontline care. And for the longer term, the focus of wellbeing initiatives must be to build flexibility and support into the system, rather than to focus disproportionately on the resilience of individual members of staff. An important part of this, and one of our key asks for the government, is to ensure that there's a fully funded, long-term workforce plan. There's been ongoing frustration about the lack of a long-term plan. Sustainable workforce numbers and funding are sorely needed to ensure workforce capacity keeps up with demand and to avoid this perennial reliance on staff resilience. Investing in this issue will mean that staff wellbeing will be better safeguarded in future. I spoke at the start of this session about the need for us to recover and return to normality. But actually, even before the pandemic, normality for NHS staff meant intense pressure day in, day out. And we need to do better than that for our NHS. We need a long-term, funded plan that makes recovery for all of us possible. Thank you.